Dental decoding reveals to us how specific teeth hold subconscious messages connected to life events, emotions, and our survival instincts. I like to refer to this with Fabian as emotional energy, which is very powerful, and it can either help us propel forward in our life purpose or keep us stuck in patterns that don't align to the highest expression of our humanity. So, Fabian, how do symbolic acts in dental decoding facilitate profound self-discovery and transformation?
Well, dental decoding, as you know, is a way of seeing our psycho-emotional uh, conflicts through the reality, through the things, through our teeth, through our cavities, through our gums, and through everything that is inside of our mouths. Because our mouth is the place where where we express from where we express who we are, from where we express our truth, and it's the the part of our body where we nutrate, we eat, we breathe. So it is a biological key place, but it is a symbolical key place. Why we say symbols? Why we have to focus on symbols? Why symbols are so important for our life? Symbols are very important in the creation of archetypes. Archetypes, an archetype is a primary mold, is where we go when where we have to do something. For example, if we have to project an idea in the future, we go to the archetype of father, father function. Father is a function, it's not a person, it's a function, and it's an archetype. We learn how to project our ideas in the future through our experience with him. And this experience, this archetype, it's a logical, a literal archetype, but it is also a symbolical archetype. Why we use symbols? Why are we so symbolic beings? Because everything that happens, it opens, it begins a process inside of our mind. So this process takes energy inside of our mind. For example, imagine the archetypical human looking at the skies, looking at the sun, but he doesn't understand why the sun is there, what it is made of, why it has light, why it has it brings heat. So okay, these shiny things up in the sky should be God. Okay, because you don't know how to explain that in the sky, you give it a a meaning. So you give it a symbol. So the symbol closes, it ends the process that was opened. So we are always giving symbols to things to close processes. So, for example, if you are a part of religious family, maybe using a symbol of that religion, maybe a cross, that symbol brings peace to the part of your subconscious that doesn't understand or doesn't feel secure, for example. So having that cross makes me feel protected. For example, you know in your conscious mind that this cross doesn't make anything, but in your subconscious mind, this cross means a lot. It means, for example, protection. It means your connection to something bigger. So every symbol has, through psychology, we know that what a symbol does is closing, giving an end to a process that was open in your mind. You cannot have thousands of process open it. So that's why we are always dealing with symbols and we are always processing symbols. For example, while you are dreaming at night, those symbols are the way your subconscious deals with processes that are opened and you cannot explain, you cannot make them fit inside your logic or inside your way of seeing the world. So symbols are there for that. And we have archetypical symbols that belong to our to the humanity and personal symbols. For example, for you, maybe a dog may symbolize fear because you had a bad experience with a dog. For other people, dog may symbolize fidelity. But we have many different symbols that will take us to different parts of our subconscious. Our teeth, they come in our mouth, they have the eruptional process through many different moments where we are developing our psyche. So, for example, the two lower milk tooth, temporary tooth, those are the first teeth coming into the mouth of a baby. The baby, when you're a baby and you don't have teeth, you think that you are one single individuality with your mother. But with those teeth, you make the breastfeeding uncomfortable for the mother. So the mother starts the process of feeding the baby with food, not with milk. So this tooth is the beginning of the separation with the mother. Is where you start knowing that you are not the same entity with your mother. So the presence of a mother that it's outside of me, that it's a separate thing from me, is represented in those milk tooth in the lower jaw. They have that symbolism that is very, very important for our subconscious, not for our conscious mind, because our conscious mind knows that teeth are there to make their work, to just chew. But for the subconscious part of our mind, which is the bigger part, it's 95% of your mind, this brings all those histories, all these experiences about nutrition, maternal nutrition. If you feel if you feel welcome, if you feel nutrited by mother, and many times just looking at those teeth in the mouth of a baby, we can understand what is happening. The same process happens with all the milk tooth and the adult teeth. Okay? So teeth are profoundly, are deeply symbolic. So when we understand this symbolism, this deep symbolism that is in our that uh, lives in our teeth, we can understand how to use the information that we can decode, that we can read in the mouth of a person to create a solution, because you are only owner of 5% of your experience, because your conscious mind is just 5% of your experience. The rest of your reality is processed by the subconscious mind. So many times you may say, okay, I do want to have uh, a partner, but something is happening inside of me that I cannot do it. I cannot have that partner that I want because something is stuck inside of me. Uh, I am doing everything I should do, but I just cannot have that partner. What is blocked inside of me? Because 95% of your subconscious mind may have an information that being in a relation or having a partner may be dangerous for your biological life or for your experience, or may be associated with a suffering or some emotional pain. So when you clear, when you change that information, that programmation in the subconscious mind through a symbolic act, you give a this person, an instant um, solution for that. So, for example, I had this client who was stuck in her life because she has this very exigent mother, very perfectionist, very demanding mother that she just couldn't handle this relation. So when you create a symbolic act, you have to use. We'll teach in our retreat what to do, what rules you have to follow to create as a symbolic act to each kind of problem you decode through dental decoding or through the therapy you use. Because dental decoding is just another therapy, but you may use any other therapy. So, for example, how can you free yourself of that matter? So the symbolic act many times have to be creative. So for her, we told her to take a plate or something that belonged to her mother, and she had to cook something that her mother would like a lot. For example, cookies. Okay, so she she can cook those cookies, and while she was cooking those cookies, she had to be completely alone and in her kitchen and cook them. And while she was cooking those cookies, he had to speak everything that was negative regarding her mother. For example, but never guilt her. Just saying, for example, I felt abandoned when you told me that. I felt blah, blah, blah when you did that. you have to speak, not thinking. You have to speak while you are cooking. You cannot taste those cookies because the symbol is that this is not yours anymore. But you are creating that, you are creating something while you are bringing a feeling. And when you speak about that feeling, you have to feel it. So you put that inside those cookies, symbolically, of course. When you finish those cookies, when she finished those cookies, she put them on the plate that belonged to the mother and she went to her house, to the house of the mother. The mother opened the door and she had to say literally, Mother, I am giving this back to you. It doesn't belong to me anymore. She, the mother, thought she was giving back the plate. But what she was giving back was the symbol. Oh, come on, daughter. You can let's take a cup of tea and let's eat those cookies. No, you don't. You cannot stay. In this moment, you have to go. Oh, somebody is calling me. I have to go, ma. I'll come back in another moment. So she went. It's amazing if you do it in the proper way, feeling the emotion, how things change, how you give back those conflicts that they were from the mother, not from my client, how her life starts changing. This change happens in the first 21 days because in those days some specific biological process happen that it's the period of time where it many things happen. You start, it's like you are light, you don't have that backpack anymore. So symbolic acts always have things that make you free, or they make you reach something, or they change something in the symbolical way, because you are changing a part of your subconscious. You are reprogramming your subconscious through symbols. Many times we have to create a symbolic act with somebody who's dead because that person is not there anymore, but I still carry that backpack. Sometimes I have to do something regarding my professional field, my work, my partner, my son, my daughter, or with a situation. Many times it is regarding a part of me that I cannot handle. For example, my devaluation. The devaluation many times becomes an entity inside of me that is bigger than my will. And many times I have to symbolically treat that devaluation as an entity, as a person, and do something to let it go or to make it change or to make her work to me. So through dental decoding, we make a diagnostic of what is happening, what is the problem, and through symbolic acts, we can give our client, or we can give the person we are talking with, a solution, something that reprogram those things. And many times, if the person do the symbolic act in the way that it is designed, it is fast. It is amazing. It's very, very fast because you are changing things. The symbolic acts many times the person who receives a symbolic act don't have to find the logic inside of it, because the logic, it's symbolic and it's made by you because you are going to design it. And we have rules and different steps to follow in order to design an individualized symbolic act. So, in my opinion, the symbolic act is one of the fastest and most efficient way of dealing with the things we find. And I use it in more than 95% of my therapies. I also use individual constellations. But in this retreat, we are going to use the symbolic act because it's something fast, it's something that you can design, and it's something that if you follow the rules, you may find a beautiful way of helping people. It does. That's where is what
That
you
is
wanted, really.
perfect. That is perfect, Fabian. Um, the from the retreat, it's going to be a combination of two things. One of them is going to be learning the prototypes and the archetypes and the dynamics of each tooth, and then to give us a window to our true emotional imprint. Sometimes we think that, well, I'm not feeling sad, but this tooth is saying another story. So tapping into our teeth and feeling our teeth is going to give us that blueprint to get to the proper place. And then we're going to create the symbolic act. That is something that you have done different in the past, that we have not created symbolic acts during the retreats. And this time we're going to learn how to do it. The symbolic acts are amazing. I have taken some of your recommendations, and sometimes they have worked within 24 hours. The main thing to remember from this is that it is not like you were saying, it becomes a person outside of you, but it's without judgment. It's with compassionate self-awareness to once again align you to the path of your highest expression in your humanity. So thank you so much for answering that. Well, now let's jump into conscious versus subconscious and their personality expression based just on dental decoding, not biological decoding, not psychology. How does personality expression in the conscious mind differ from the dynamic in the personality rooted in the subconscious?
This is because we have a personality that we know in our conscious mind, and we have a personality that we cannot deal with, that it's just automatic. For example, I may feel nervous when I have to talk in front of a lot of people. Okay, this is part of a subconscious personality. I cannot manage. I just cannot manage that. Uh, so the personality that I can change, that I am aware of, and that from where I take my decisions is this conscious personality. And the other part is the personality that I cannot deal with. Usually, this personality is the part of our personality who hides those conflicts that are for self-protection, because they all have this motivation of surviving of the biological life, but they are profoundly rooted in archetypical experiences, usually in our childhood or in our adolescence. So when we understand what is happening, and we may feel, because our teeth are made of crystals, and as each crystals, they can transmit energy. So we learn how to feel the energy and the circuits, the psycho-emotional circuits that are in our teeth, to learn where we have a blockage and how our subconscious personality is rooted in there. For example, many times when we have a blocking in the energy in some of the second premolars, we know that the second premolars are the wounds of the soul,
Mm.
betrayal, okay, injustice, betrayal on the upper right second premolar, injustice on the upper left second premolar, jealousy and envy in the lower left, and frustration in the lower right. When you two, they touch, they make contact, just like two cables, because they have a logic, they have a circuit, and many times the cavity separates them and protects you from making that contact. We learn how why cavities are a electrical conflict in the surface of the teeth that creates the depolarization and makes the give the bacteria a possibility to create the cavity just to prevent the touching of two teeth. So we'll always be dealing with that subconscious dynamic part of our personality, and we'll try to reprogram it. Many times when we see a panoramic x-ray and we see the shape of the roots, we may see the programations that we have from our ancestors,
Mhm.
because in the roots you may see the programations that you have from your family. So this combination between feeling and giving a solution, I think it is very valuable to give a client or a person you are treating a fast solution, or at least uh, helping that person to 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 be in a good situation again.
One of the questions that we had before the Zoom meeting, there was, what if somebody doesn't have any teeth or they're missing some teeth? How can you tell what problems they have or what patterns they have imprinted in their mouth?
If you don't have the any teeth, you we may know through the history of why, or the sequence of how do those teeth were lost, we can understand what happened. But touching, you not when we touch here from the outside, touching, you are not touching the teeth. You're touching the energetic field, the energetic body of the teeth. And you will always have that energetic body if you have the physical teeth or if you don't have the physical teeth. And when you touch and you connect, because you have to close your eyes and connect, you will see, you will feel what is happening.
Mhm.
That's why we have those techniques of touching from the outside, because we have that energy. That energy, it's electrical energy. We are electrical beings, and we feel it as a tingling on our fingers. This is because we have a piezoelectric function in the tip of our fingers, in that part, because of the amount of minerals we have there. So we can touch it very, very, very well using this technique.
A lot of people have wondered if we actually put our teeth, our fingers in our mouth, or we're feeling somebody else's.
No, it's just from the outside.
Yeah.
Always outside. Yeah, because what we are feeling is the energetic body is not, you don't have to touch the teeth.
How about yourself though? When we go, one of the meditations that you have shared with us in the past is that when we go to bed, we're in meditation and we want to know something about a tooth. For instance, with me, my work. So I'm gonna go to molar number 3 or tooth number 3, and I'm gonna tap on it. And then as I'm going into theta, it is the dream is going to symbolize something that I have to do with my work. If I know myself and I can guide myself through my symbols and
Yes,
my
this
dreams, they're
this
answers.
tooth this tooth symbolizes the dream, but it always symbolizes the gaze of the father. Why the gaze of the father is with the dream of the soul, not the dream when you are dreaming when you are asleep.
Mhm,
A dream you have in your soul for your future. Because when you're a child, you are always looking for the gaze of the father when you do something, when you're doing something new. The father function, maybe you don't have a biological father, but it's always somebody doing that function. So that gaze gives you the the confidence, gives you power to go for what you want to do. So when you have a dream, you look for that gaze.
mhm,
And if that gaze is not there, or there's a conflict in here, you just cannot project your dreams in your future. So you think that you are not able to reach those goals you have inside.
mhm.
Sorry, I interrupt you.
No, you're fine. You're fine. It's perfectly well. Give us a little bit more information about the retreat that is happening at the end of February in Loveland, Colorado.
It's going to be amazing because it is a retreat because we need the physical presence, because we need to touch, and we'll work in groups just to learn how to create a symbolic act for the actual person that is there. And you need the person to feel, just to try to diagnose what is happening, just to learn how to feel that psycho-emotional energy, because relations are expressed in our teeth,
Mhm,
the most human part of our relations, because the rest of the body is more linked to the biological survival, but teeth are a part where we are conscious of our consciousness.
mhm,
So is how we look at our own humanity, at our own behavior. So that's why teeth are our relations. So in this retreat, we'll be living together 4 days. We're going to share all those secrets, and we'll learn how to the different ways of creating and designing an effective symbolic act, depending of what you are dealing with. Maybe you want to release something, maybe you want to grab something new. Many times you have a conflict of separation, you have a conflict of territory, you have a conflict of uh, of fear. We have different kinds of conflicts, and for all of them, we have different kinds of ways of designing those symbolic acts. So that's why I think it's going to be an amazing time together.
Before we open the floor to the to questions, the room to questions, the the relationships that you're talking about, because there's a lot of people here that have not taken any of your courses, and our mouth is divided in relationships to oneself. Can you go through that again for us?
Because we have three ways of relation,
Mhm,
and the three ways of relation they act simultaneously. We have the first level is the relation with our ancestors, where if you like it or not, you are an extension of your ancestors. The relation with them, if you accept this lineage, and or if you don't accept that lineage, it will create different conflicts. So the first thing is to be in peace, or at least to accept where you come from. You can change it, but you have to accept your roots. The second level of relation is the relation with others. The relation with others give us the possibility of survival because we are collaborative entities. So for us, the relation with others, for our animal inside of us, give us the possibility of survival. So how we relate with others. And the third level is the relation with myself, where I look at me and I think that I am being unfair with that situation. So who's the one who's being unfair? The one who observes or the one who's being unfair? So it's like there are two parts of me, two separated parts of me, and many times many more. So the way you are with yourself is the same way you are with others and the way you are with your ancestors, because you are the same way, you use the same archetypes in the three levels. So for example, regarding father function, in tooth number 8 brings us the memories of father function. So how was my relation with my father function and my ancestors as father function? And how I deal with authority, because an authority is a father function, and how I give orders to myself inside of me, they are all using the same archetype. So it's amazing how when you understand the 32 different archetypes who are inside of our psyche, because this is psychology, and how it symbolically it's expressed in our teeth, you can see in the matter how psychology is expressed.
Thank you, Fabian. I think dental decoding is one of the most transparent forms of psychology. A lot of times when we go to psychologists, we're just telling a story, the story that our conscious mind wants to tell, the result that we want to hear. Yet through dental decoding, it's very forward. It tells the truth about our lives and what we need to solve. So thank you so much for once again coming to Colorado in February. That's February the 20th, 4 days, and it's in Loveland, Colorado. And all the information will be posted in the chat. And right now, we're just going to open the room to any questions that anybody may have.
I have a question. I wonder if there's any relationship between this method and total recall therapy, which came out of total biology, which came out of new medicine in Germany. Just curious.
Yes, yes, of course. It's a part of that. As it is it is focused on relations, and in the highest part we have this separation, but yes, it is a part of total decoding. It comes from the new German medicine. Of course it has it, we use the same laws, we use the same way of thinking, so yes, you're right.
Meaning mesoderm, ectoderm. I mean, of course, new medicine got transformed in France by Dr. Sabat
Mhm.
and became total biology, and um, Renault in Canada then turned his version into recall therapy. So it's really has progressed. But yours is more of a direct relationship to new medicine out of Germany.
No, it's more to total biology, more to total biology. And now is what we do here, because there's a lot of psychology. It's not just decoding. So that's why we have our course, separated from total biology because we need to give a lot of information about psychology. Okay, but it's in the way, in the same way that total biology.
But that's
It's
great that I have explained this in the past, Fabian, for people that are, said total biology is a biological decoding. What is it? It's an extension of it that will help you, if you're a practitioner, see how your client is doing or how they are associating with their relationships. And you can include it in your sessions. If somebody's having a problem in the lower left side, then you know it's part of their family or their front teeth. You can ask additional questions that will help you get to the root of the problem faster. And for yourself, it's definitely self-discovery.
Yes, exactly.
Cheetah, I'm not seeing my computer very well, but you have your hand up, so go ahead and ask your question, please.
Hi, can you hear me?
I can hear you, yes. Can you hear her, Fabian?
Yes, yes.
Great.
Hi, calling England. Good morning. Question, teeth cleaning, and that means that all your teeth provided.
Sorry, I cannot understand. I think there's a problem with the mic.
Oh,
Ruby, did you understand what she said?
It's breaking up. I think it's a connection. That's what I'm picking up. You can
Maybe
definitely
you can type it down.
question. Yes. Let me check in the chat real quick. There was a question at the beginning. It said, what if you have many teeth, molars extracted? We already covered that. What if babies were not breastfed? How do they create that separation from the mother?
Well, this is how do they create the separation if there's not breastfeeding?
Mm-hmm.
Because those teeth are the first thing in touching any kind of nutrition, but not breastfeeding. That's why we teach a lot of psychology. Not breastfeeding will bring some sexual issues when you're an adult,
Oh, wow.
because the amount of pleasure you will ask your partner in a situation of intimacy, it is linked to the amount of oxytocin you receive through the breastfeeding. So when you are not breastfeeding, the sexual part of the person is going to be an issue, and many times we can see that on teeth, in the adult teeth. But those teeth are the first contact of those crystals with any kind of nutrition. That's why they are linked to the most archetypical nutrition. If you were not breastfeeding, we'll see this sexual way of dealing with things, that we have a retreat for that, and we'll see that through fixations, for example, oral fixations. That it's another topic,
Doing the nails and doing things like that. Got it.
and many others. Yeah.
Yeah.
Oh,
Teeth
wow.
grinding, the meaning. There's actually a class, and we have her here with us with Isabel Perez. Dr. Isabel Perez has a really good class on dental grinding, and I will send you that link. I'll let Fabian answer that as well.
The grinding,
Mm-hmm.
we have different kinds of grinding, but for example, bruxism,
Uh,
when you grind in the lateral facets, not just pushing your mouth, just you press and you move, So that kind of grinding, it's a strong emotional separation between the part of yourself, let's say your ID, and your super ego. The ID are our instincts, and our superego are the morality, are the rules we follow in life. When there's a situation where there's a strong separation between what you want to do, what your in your internal animal want to do, and what you have to do, is where you start doing this grinding. For example, you live with your partner and you don't want to be with that person anymore in your life. I want to run away. I want to stop being with that person, but I have to be with the same person for the rest of my life because I said yes in the church. So this strong separation creates that grinding. What you have to ask is when this becomes there are many different ways of grinding and ways of finding where it comes from. But just for the record, is this strong separation. Usually is this strong separation. 90% of the time. 10% of the times, it's when you feel a symbolical invasion in your territory. For example, you think that somebody may be trying to get your position at work, or somebody would want to be with your husband, or somebody trying to invade, symbolically invade your territory. But this is just on the 10% of the cases. 90%, is the difference between the ID and the superego.
Mhm. Is that good an answer for you, Chica? Yes, wonderful. All of this that he's talking about, the conditions and the different cavities and the expression of the teeth, orthodontics as well, they're covered between modules 1 and 3, which they are done online, correct, Fabian?
Yes.
And we will be sharing
Yes.
all that information if you guys are interested in the follow-up with the recording here. Another question that we had, and it says, can the non-breastfeeding absence be decoded?
Please tell me that again.
It's in the chat. It says, can the non-breastfeeding absence be decoded? So if somebody wasn't breastfed, can that be decoded?
Through teeth?
Mm-hmm.
Through teeth, yes. Sometimes you can say, but remember that teeth are just a tool in dental decoding, because teeth tell us what to talk with the person. There are many questions we have to ask through that. But breastfeeding, we can see that many times you may see shorter roots in the first premolars. You may see the roots of the central incisors and lateral incisors in the lower jaw, all of them looking at the same point. We can see different things that may indicate that.
Does anybody else have any other questions? I think we have time for one more. Thank you. Thank you so much.
Do you need x-rays and things to do this process? And the training in, or whatever it is in Colorado, if you're not interested in being a practitioner, but you just want to do this as a therapeutic tool and you can't go to Colorado, how do you get a session in it?
I have never taken a session. I've taken the whole course. This is going to be my second time doing the retreat, and it's It's something that I had valued very much in my life because it has opened the window to a lot of things that I could not be aware without this. My personality, the way that I relate to things. A lot of times I go to Fabian and I ask a question, hey, what about this guy or this person is annoying me? Can you tell me how can I do this with my teeth? Or why is this pattern continuing to happen? And he'll look at my teeth and he'll find something completely different. And I'll notice that he's going in the right way because I'm starting to feel irritated, emotional, and then pretty soon the doors open and there's the answer. So it is very beneficial for anybody that has ever that wants to take this as a self awareness, self-discovery tool. You don't need to take any of the online courses, correct, Fabian? To do.
No, you don't need any of the previous ones because this is just experience. But many times it helps to have the panoramic X-ray. It's not mandatory, but it helps. It helps a lot because many times uh, we can go to the panoramic X-ray and just have another way of looking at at the conflict that we're feeling.
Most dentists will do it. The most expensive that I've ever heard that in panoramic X-ray of your whole mouth is $100. So you can ask your dentist, your local dentist. We have never had a problem with somebody not finding them.
It's not mandatory, but if you have it, it's better.
You do not need any of the other courses to do the retreat in Loveland. And this is the first time that Fabian is combining Feel the Teeth with the symbolic acts. And the reason that we're doing that is to give an answer, to give you the tools so you walk away from the Feel the Teeth retreat with the ability to create the symbolic acts.
So I guess I'm still not understanding what the symbolic acts are. Can you give a demonstration of doing that process?
You probably join a little bit later. A symbolic act can be like he was talking about the cookies, creating that separation from the mother. The daughter was creating the separation from the mother by baking the cookies and creating the emotion as she's baking them, and then giving them to the mother to create the separation from the conflict that she was having from her mother. The symbolic act is making the cookies, charging them emotionally, and releasing them.
Oh, I see.
Yes,
Just inventing your own,
it
creating your own symbolic act, just using your imagination to create your own physical symbolic act.
Mm-hmm. They are rules.
yes, but
that you
they
want.
have rules and what you have to follow, what things you have to include inside the symbolic acts just to make it efficient. Because many times, for example, there's a person who has had a bad experience with a relation with a partner, for example, and has a lot of conflicts regarding that relation who finished. So, for example, one of the symbolic acts would be writing down how you felt in at least 7 different moments of your relation. Uh, then we'll explain why 7. And how you felt, not guilting the other, just defining, identifying how you felt. You write them down, then you name them, and when you have that paper in front of you and you name them, you have to have in this table where you are doing things, you need to have a plant, a little plant, uh, a glass of water, and you fire that letter. You take some of those ashes, you take them with you, and you go to the yard. You make a hole you plant that plant, and with the earth, you put some of those ashes and you water that plant with the water that was present. And you have the four elements that they change because the fire changed things, it transmute things through the ashes in new life represented in the plant. If you do it with your emotion and you identify your feelings, you are changing that into something that means life, a new life. So that closes one process and gives you permission to start all over again with a new life. It has many other things, but I am just trying to describe what kind of things you have to use into a symbolic act. Okay?
Yes, I understand a lot more now. It's a lot like other schools of ritual and ceremony have very similar things. So okay, I got it. Yeah, it's your particular
Exact,
version of that. Yeah,
exact,
thank you.
exact. Yes, yes. It comes from there, but it has the division of the psychology. Because what we saw through time that many symbolic acts were so strong that you create a conflict with the symbolic act, because many times in the symbolic act they told you that you have to go to the church and make poop in the church. This doesn't work because you're going to create a conflict in doing that. So now we know that they should be strong, but they should not be a conflict. And many times you have to face things that you don't want to face, but in a way that you can do it, not just to make you another source of frustration. So there are many things that has to be taken in account.
Is the power of the retreat in Colorado such that you have others supporting when you're doing your symbolic act, or is that a real solo event?
Not quite understanding your question, Irene.
Well, if there's a retreat or workshop in Colorado, then if you find that you need to, it gets revealed in the process of the workshop that you need to do a symbolic act.
Mhm.
So the other people in the workshop all support you in that just energetically, but it's still for you to do alone.
We do a symbolic act as a group, and we're going to learn how to do them for ourselves and for each conflict, so we don't create additional conflicts. I have done many symbolic acts before I took Fabian's class, and I think I was just getting more conflicted as I was creating them. So taking his class has really helped me on how to, one, accept it. As he says, you have to accept it. The process, this is not just I'm going to make a wish and this is what I want. Accept the process, and then if you wish to release it, then you release it with the proper tools.
So we'll get to know specific tools for specific conflicts.
Yes, ma'am.
Okay, thank
Exactly.
So it is 11 o'clock for Fabian, and I do not want to keep him up any later. I thank everybody for being here, especially you, Fabian. It has been an amazing adventure learning everything about the teeth and how it expresses in our psychology and in our soul's path. Your work is amazing, and I will continue to share it as we go on. And I hope all of you can join us in Colorado. It is coming up at the end of February. It is not that cold in February in Colorado. It is a little bit dry, but not that cold. And we'll share all the information and the details about the retreat and the beautiful Sunrise Ranch. Thank you again for being here. Thank you, Fabian. Everybody, have a good night. Thank you.
Thank you all. Thank you for your presence.
you.
See you there. Bye bye.